All right, so veins and arteries. What do you do? What do we do for veins? What do we do for veins? Okay, so you're on the right track. Okay, so we got dangle and we have elevate. So you do what for veins and you do what for arteries? Does that flow with the acronym? Dave, D-A-V-E, dangle, veins, elevate. Right? So we dangle your arteries, you elevate the veins. Okay? Dangle arteries, elevate the veins. Potassium. Potassium is contraindicated with what? If your patient is not what? If your patient has decreased urinary output or anuric, you don't give potassium. When drawing up insulin, what before what? Who? Clear before cloudy. Clear skies before the clouds, right? Clear skies before the clouds. And you do not mix what? Which insulin you don't mix? You do not mix Lantus. It can, or it can come in a vial. MAOIs. Give me the 3 medications typically given for MAOIs. There's 3 of them. Parnate, Nardil, and Marplan. No, that's just those are just the 3, the top 3, If you have a patient on digoxin, going home teaching, what do you want to tell them? Check the what? Yes. If it's less than what? You do what? You hold it, right. Hold less than 60. That's right. This medication treats seizures and it has a therapeutic drug level of 10 to 20. This, which one? Dilantin. Right. Dilantin is a 10 to 20. Yep. This medication treats asthma and it has a drug level of 10 to 20. Theophylline. Your patient is taking allopurinol. What do we want to tell them? What do we want to encourage for the patient that's taking allopurinol? Allopurinol? Beta blockers are LOLs. Allopurinol. 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 What is allopurinol for? Gout. That's a gout medication. Xyloprim, allopurinol. Allopurinol is generic. And it's gout medication. Gout is what? Buildup of what? Exactly. So we want to encourage what? No. Fluids. We want to flush. We want to flush. Yes. 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 Okay. Haldol, antipsychotic medication, can lead to what type of side effects? What's that E word? It's an E word. Most antipsychotics, but specifically they're talking about Haldol in this one. Extrapyramidal side effects. Remember I talked about that with Parkinson's? Extrapyramidal side effects. What medication do we give for these extrapyramidal side effects? Cogentin, to treat the extrapyramidal side effects. Cogentin is the drug of choice.
You said that's the drug of choice?
Yes. How long does it take for antidepressants to work? Up to 3 weeks. Up to 3 weeks.
Antidepressant?
This disease is an X-linked recessive trait. The mother passes it to the son. Who am I? Who is this disease?
RH factor?
No. RH factor deals with pregnancy. This disease is a X-linked recessive trait. The mother passes it to the son. It's 2 types. You got an A and you got a B. H. First letter starts with an H. No. HIV is not X-linked. Hemophilia. Hemophilia A, also known as classical hemophilia. And then you have hemophilia B, which is Christmas disease. So hemophilia is a X-linked. No, Donald, it is not hepatitis. It's hemophilia, X-linked recessive trait. Mother passes it to the son.
And then you said hemophilia B?
Hemophilia A is also known as classical hemophilia. So if they have it on the test, it's classical, same as hemophilia A. Hemophilia B is Christmas disease. Yeah.
Why do they call it Christmas?
That's your homework. Okay. What is the medication given to the mother who is Rh negative to protect the next baby? What's the medication that they get?
Is that for RH negative?
Rh negative mommies. They're given this injection to protect the next baby. What's the name of it? Rogam. Rogam. R-H-O. Gam. Rogam. Rogam is to protect the next baby. At what age does the anterior fontanelle close? What age? Close. 18 months. 18 months. Yep. Year and a half. 18 months, the anterior fontanelle closes. The posterior fontanelle closes when? Posterior. Where's your posterior? Posterior. Post. Keep going. There you go. Keep going. Keep going. Back. There you go. Anatomical positioning. Posterior fontanelle closes at 6 to 8 weeks. Yeah, posterior. Yep, anterior, posterior. What is the drug of choice used for uterine stimulation? Feel free to answer, guys. What is the drug of choice for uterine stimulation? Pitocin. Pitocin.
What is the one they gave you after you delivered and they said it goes to make the uterus contract after the baby's out to make it come down or shut up? It start with M.
Methergin?
Yeah.
What is the name of the medication used for lung expansion? When you're having a baby preterm, they want to give this so the baby could have lung expansion, so they won't have a collapsed lung. What's that medication called? We talked about it. Nope, it's a steroid. It's a steroid. Celestone or betamethasone. That's a funny word. This is for lung expansion. Yep, this is for lung expansion. What is Celestone? What is Celestone for? What is it called though? In us, we have it, right? It's a synthetic version of surfactant, right? Remember I talked about the surfactant and how the surfactant keeps the alveoli expanded, right? If those alveoli collapse, you have what? What is that called? What is that called, that process? It's atelectasis, okay? Atelectasis, collapsing of the alveoli, which can cause what? Collapsed lung. Thank you, Candace. I miss you, Candace. This medication is contraindicated if deep tendon reflexes are ineffective for a patient in preterm labor. This medication is contraindicated if deep tendon reflexes are ineffective. If the patient experienced seizure during this administration, you want to get the baby out. Stat C-section. What medication is it? What do we use to stop preterm labor? OB nurses, where you at? What do we use to stop preterm labor? Mag sulfate. Yep. Mag sulfate. Mag sulfate. Which one is long-term? Counseling or crisis intervention? What is long-term? What is long-term? Therapy. Is counseling long-term therapy or is crisis intervention long-term therapy? Counseling. Counseling is long-term therapy. Yes, that answer was mag sulfate to stop preterm labor. You're aspirating for CSF in a patient suspected to have meningitis. Got that part? Aspirating cerebrospinal fluid in a patient suspected to have meningitis. What should you know? What should the cerebrospinal fluid contain if they have meningitis? They would have a high this and a low this. Nope. What would you note in the cerebrospinal fluid? You can't note blood pressure in cerebrospinal fluid. Yeah. So like protein. So it will have a high protein and a low glucose. Yep. And it is cloudy. That's right, Candace. It's cloudy because of the protein. Exactly. Yep. And a low glucose. What is the antidote for Tylenol? What is the antidote for a Tylenol overdose? It is mucimist. Go with your first mind. It is mucimist. Yes. They're not going to give you brand names on Nclex. So what is the generic name for mucimist? You got to say it. You got to say it. Acetylcysteine. Acetylcysteine. What is the antidote for Coumadin? Antidote for Coumadin. Vitamin K. Say it loud, say it proud. You know it. Vitamin K. So we tell people on Coumadin to avoid what food? You got it. You got it, sister. All right. What is the antidote for ammonia? If your patient has a high ammonia level, you can expect the doctor to write this prescription. Cheryl, what do you think? Ammonia. Lactulose. Lactulose for ammonia. Yep. So what is the expected outcome when you give a patient lactulose? What is the expected outcome if you give a patient lactulose? What are you going to see? Bowel movement, right? That's right, Monique. I know, I hate spelling too. Yep. Ammonia. Ecchymosis in the umbilical area is seen in pancreatitis. What is that sign called? Ecchymosis in the umbilical area is seen in pancreatitis. What is that sign called? Anybody remember? Monique, you remember? Nope. Ecchymosis in the umbilical area seen in pancreatitis is Cullen's sign. That is the Cullen sign. Cullens. Cullen's sign. Yep. Cullen's sign.
And that's for what again?
Murphy's sign is pain with palpation of the gallbladder. That's for cholecystitis, Monique. For Cullen's sign, Cullens, that is ecchymosis in the umbilical area, and that's seen with pancreatitis. Say it again. Ecchymosis. Yep. ECCHYMOSIS. Pain in the right lower quadrant is indicative of appendicitis. What do we call that area? Right lower quadrant. What do we call that area, though? It has a name. It has a name. It does. It has a name. Yep. It has a name. McBurney's point. If you just had it, you say it. Be proud.
Because it was throwing me off. I forgot.
McBurney's point. Yep. What do we want to watch for if our patient has appendicitis? What do we want to be mindful of? What can that potentially turn into? That could be life-threatening, yes. What does it start with? It starts with the P, actually. Because if that appendix ruptures, it goes, what's that word called? What's this area? Starts with P. Peritonitis. Peritonitis, yep. Peritonitis. Give me left lower quadrant pain is indicative of what? You should know this because I gave it to you like 1,000 times, so I'm not accepting a wrong answer. Left lower quadrant. I'm not going to tell you. Left lower quadrant pain, Facebook, is indicative of what? Left lower quadrant.
Can I get the letters up?
D. Diverticulitis. Diverticulitis, left lower quadrant pain.
And then you said diverticulosis and pocket, right?
Chronic. Okie dokie. This abnormality is where the urethral meatus is located on the ventral of the penis. It's on the ventral surface of the penis, the urinary meatus. What is the name of that? What is this abnormality in which, urethral. What is this abnormality in which the urethral meatus is located on the ventral surface of the penis? Hypospadias. Ventral is what? In relevance to anatomical position. No. Back. Ventral. Back that way. Yeah. So it's on the back surface of the penis. Okay? So it's the hypospadias. So if you're looking at the anatomically, where would the back surface be? No, that's epispadias. Back. Underbottom, right.
Yeah. But I don't understand
the positioning of the urethral meatus, so you know where it's supposed to be on a man, right? It's supposed to be at the tip, but if it's underneath it, that's going to be hypospadias. So below is hypospadias, above is epispadias.
So what is it causing a problem?
Urination. Yeah. Infection. All types of infection is always a good one.
So do it affect the libido or stuff like that also?
I don't know if that has anything to do with it though, but I think it's more so of just the infection and the urinary part, right? Thanks, Candace. See you later. We got to do stuff. All right. Anticholinergic effects. Dry mouth. Urinary retention. Constipation and blurred vision. If your patient has a red, beefy tongue, you can almost assume that their diagnosis is what? No. They have a red, beefy tongue. You can almost assume that their diagnosis is what? Pernicious anemia. That is a cardinal sign of pernicious anemia, a red, beefy tongue. And What else? Pernicious anemia. Kowalski is strawberry tongue, Liz. Red beefy tongue. Yep. Red beefy is pernicious anemia. These patients take what for the rest of their life? What medication do they take for the rest of their life? Hey, Ty.
Iron.
No. Iron is iron deficiency anemia. Pernicious anemia, they're lacking that intrinsic factor, right? So what are they going to take for the rest of their life? B12. B12.
That was probably my first test.
Mm-hmm.
I didn't know what.
They talk, yeah, they do ask a lot of those questions on there. That's right, Mo. B12. What are your two priorities for interventions for sickle cell crisis? Interventions. Priority interventions for sickle cell crisis.
Prevention of
Pain
pain.
and
Comfort.
fluids. They're not hospice. We're not gonna do comfort. Sickle cell crisis, fluids and pain.
With them, they will only get pain. What do we give them?
What are we giving for pain?
Like they get the pain because of the cells and the shoe cells that build up.
Mm-hmm. Yep. So they get what's called a vaso-occlusive crisis, and that's when those sickle cells they clump together and they cause pain. So that's vaso-occlusive. Yeah, they do. They get frequent blood transfusions. Yes, they do. They get frequent blood transfusions. But our whole idea is pain and fluids. That's our whole idea for intervention. Last 2 points, guys. Glaucoma versus cataract. What's the difference?
Cataracts is a clouding of the eye.
Opacity of the lens. Okay. Is it painful or painless? Painless vision loss.
Glaucoma is like pressure,
IOP. Increased intraocular pressure. Right. Glaucoma is painful vision loss. All right. So you got the tunnel, halo vision, peripheral vision loss. Cataract is painless. No, central is macular degeneration. Macular degeneration is an age-related condition that causes, retinal detachment is visual floaters or curtain vision. Yep. The flashing, flashes of the light, that's retinal detachment. Increased intracranial pressure has what signs and symptoms? It's 3 of them. We call it the Cushing's triad. Increased ICP, yes. Increased ICP. We call it the Cushing's triad. It has 3. Triad 3, right? So what do we see with increased ICP? Nope. Think more of vital sign assessment. Yeah. Something that you can measure. You said what? Increased heart rate with increased ICP? You sure? Bradycardia. What else? What else is going to be Brady? Yes. Decreased respiratory. And what's going to be high? Blood pressure. Yep. So you have hypertension, bradyapnea, and bradycardia, right? So think about it though, because if you have increased intracranial pressure, where is that pressure at? Where are you going to have that pressure at? Right. So what's back there? Yeah, but what's more important that's back there? Your brainstem, right? Brainstem controls what? Be specific. Heart rate, respiration, right? All of that. So think about it like that. That's right, Monique, the medulla. Shock. Shock has what symptoms? Shock has what symptoms? Just think about it. Patient in shock, they have what symptoms? Hypotension is one. Thank you, Liz. Hypotension, low blood pressure. So what are you going to see? What's the heart rate going to be? Up. Yep. Tachycardia and tachypnea. Okay. What is the sign of Duchenne's muscular dystrophy? Duchenne's muscular dystrophy. It's important. It's on Nclex. Gower sign, right? Using of the hands to push themselves off the floor. Okay, Gower sign. Thanks, guys.